everyone, nice to see you again. In our last episode, we discussed what happened in December last year with the coronavirus or CCP virus issue in China. We mentioned how in the last few days in December, 3 different labs in China have all identified a SARS-like new virus and reported this to both the hospitals and authorities. One researcher warned that a grave public health problem was looming. Today, let's continue to discuss what happened in January this year. On January 1st, 2020, when people were celebrating a new decade, many unusual things happened in Wuhan. First, the South China seafood market, which was claimed to be the origin of the COVID-19 or CCP virus outbreak, was closed and cleaned up without swabbing individual animals or their cages, without drawing blood from everyone working there, or otherwise checking who might have been infected. Guan Yi, a top Hong Kong virologist, whose research on SARS had helped the Chinese government avert the 2004 outbreak, later criticized this move. He traveled to Wuhan with his team on January 21st and 22nd in hopes of tracking the animal that was the source of the virus, but left without being able to do anything. He said to a reporter later, "There's no crime scene." He also owned that the Wuhan coronavirus epidemic could be 10 times as bad as the SARS outbreak. On the same day, the Wuhan Public Security Bureau issued a summons to Dr. Li Wenliang, accusing him of spreading rumors. 2 days later, at a police station, Dr. Li signed a statement acknowledging his mistakes and promising not to commit further unlawful acts. 7 other people were arrested on similar charges, and their fate is unknown today. Also on that day, after several bunches of genome sequence results had been returned to hospitals and submitted to health authorities, an employee of one genetic company received a phone call from an official at the Hubei Provincial Health Commission ordering the company to stop testing samples from Wuhan related to this new disease and destroy all existing samples. According to a New York Times study of cell phone data from China, on that day, 175,000 people left Wuhan. According to global travel data research firm OAG, 21 countries have direct flights to Wuhan. In the first quarter of 2019, for comparison, 13,267 air passengers traveled from Wuhan to the United States, or about 4,422 per month. Also, according to a study published on the New England Journal of Medicine, 7 healthcare workers were infected between January 1st to January 7th. 8 were infected between January 12th to January 22nd. The authors of this study are researchers from the China CDC. This means Chinese experts and researchers already knew at that stage that human-to-human transmission existed. Otherwise, health workers should not have been infected. However, nobody warned the public. Then on January the 2nd, the Wuhan Institute of Virology completely mapped the genome of the virus. However, the Chinese Communist Party, the CCP, would not announce that breakthrough for another week. An opposite move on this day was Wang Yanyi, director of Wuhan Institute of Virology, issued a notice to researchers to pass on a telephone message by China's National Health Commission, forbidding anyone from disclosing epidemic-related information, including tests, lab data, results, and conclusions to any media outlets, including official media even, or to partner institutions, including technical service companies. Researchers were also banned from releasing information on social media platforms or to anyone who runs personal media platforms. Also, a very strange move on January the 2nd was, while virtually nobody had known anything about the nature of this pneumonia of unclear cause, a military university in Wuhan, Naval University of Engineering, issued a lockdown notice and started to strictly control entry of any outsiders. Visitors needed a special permission to get in and must take a temperature at the school gate. Anyone whose temperature was higher than 38 degrees was prohibited from entering. Please note, this was 18 days before the CCP admitted that there was an epidemic and 21 days before the lockdown of Wuhan. Why did a military university take such a step at such an early stage? That is a question that needed to be asked. Also on this day, Dr. Ai Fen of Wuhan Central Hospital, who gave out the information about a contagious SARS-like virus in her department group chat, was given a talk by her supervisor and encountered unprecedented, very harsh reprimand. Ai Fen said after that talk, she felt a complete mental breakdown and would not talk to anyone who asked her questions. On January 3rd, China's National Health Commission issued a national gag order prohibiting any institute from providing biological samples and related information to any other institute or individuals. All institutes and individuals who had already gained samples should destroy them immediately or hand them over to designated institutes. Even Wuhan Institute of Virology was once asked to stop doing pathogenic tests and to destroy samples already gained. Also, on this day, local police called in Dr. Li Wenliang and reprimanded him for spreading rumor. Also on this day, Wuhan Health Commission issued a notification saying that 44 cases of pneumonia of unknown cause were found, but there was no evidence that this disease was human to human. On the same day, Singapore announced that it would start taking the temperature of passengers coming from Wuhan. Also on January the 3rd, Professor Zhang Yongzhen of Fudan University in Shanghai received biological samples packed in dry ice in metal boxes and shipped by rail mail from Wuhan Central Hospital. Then let's move on to January 4th. The first expert group of China's National Health and Medical Commission publicly stated that at present, no obvious evidence of human-to-human transmission was found. Also on that day, Hong Kong activated its serious response level to the outbreak, while the CCP authorities continued to insist that the virus could not spread from one person to another. The head of the University of Hong Kong Center for Infection, Hu Pak-liang, owned that the city should implement the strictest possible monitoring system for mysterious new viral pneumonia that has infected dozens of people on the mainland, as it is highly possible that the illness is spreading from human to human. On January 5th, Professor Zhang Yongliang of Shanghai Public Health Clinic Center also identified the new SARS-like coronavirus through using high-throughput sequencing and provided the genomic sequence of the virus to Shanghai Municipal Health Commission as well as China's National Health Commission. Owning the new virus was like SARS and was being transmitted through the respiratory route. This sparked a second emergency response within the Chinese CDC system on the following day. Also on this day, WHO issued a statement saying that on December 31st, 2019, the WHO China Country Office was informed of cases of pneumonia of unknown cause detected in Wuhan. Also on that day, Wuhan Municipal Health Commission stopped releasing daily updates on the new cases of the disease. On January 6, according to Dr. Lu Xiaohong of No. 5th Hospital in Wuhan, patients started to flock to the hospital. On January 10th, both the emergency and the respiration departments were overwhelmed and couldn't take any more patients. After January 10th, new patients had to be sent to other departments. Medical workers didn't put on protective clothes, and patients were allowed to go to different departments freely. Dr. Lu said all this had accelerated the spread of the virus. Also on January 6, the US CDC issued a level 1 travel watch, the lowest of its 3 levels for China's outbreak. It said that cause and the transmission model weren't yet known, and it advised travelers to Wuhan to avoid living or dead animals, animal markets, and contact with sick people. The US CDC also offered to send a team to China to assist with the investigation, but the CCP declined. A WHO team that included 2 Americans would visit later on February 16th. On January 7th, Dr. Li Wenliang, who was the whistleblower of the disease, contracted the virus himself. January 7th was also the date on which CCP's head Xi Jinping later claimed that he started to oversee the disease control effort in China. In the meantime, people of Hong Kong rushed to buy masks as cases in Hong Kong had increased to 30. On January 8th, China's Health Commission confirmed that a new strain of coronavirus was the cause of the disease, while a number of medical workers at Union Hospital in Wuhan had already been infected one by one. However, the authorities claimed, and the Western media continued to repeat, quote, "There is no evidence that the new virus is readily spread by humans, which would make it particularly dangerous, and it has not been tied to any deaths," unquote. The official statement from the World Health Organization declared, "Preliminary identification of a novel virus in a short period of time is a notable achievement and demonstrates China's increased capacity to manage new outbreaks. WHO does not recommend any specific measures for travelers. WHO advises against the application of any travel or trade restrictions on China based on the information currently available." Also on that day, the first suspected case appeared in South Korea. On January 9th, Xu Jianguo, a lead expert in the response team, told Chinese state media that researchers mapped the full virus sequence 2 days earlier and believed it was a new virus. WHO also released a statement about the situation in Wuhan, suggesting a new coronavirus was at work. On the same day, Wang Yuedan, a professor at Beijing University, said to a radio station in Hong Kong that according to what happened with the SARS outbreak back in 2003, it was highly possible that this novel coronavirus would spread from human to human. Also on that day, Dr. Ai Fen started to require giving out masks to patients and asking them to wear it after seeing one patient coughing towards everyone, despite everyone else saying this was not contagious. On January 10th, the second expert group sent from Beijing to Wuhan told the media that according to the situations of patients' illness and spread, the overall epidemic is, quote, preventable and controllable, unquote. In an interview with Chinese media Caijing published on February 26, one expert in the team revealed that the hospitals and local authorities hid to the experts the fact that some medical staff members were already infected. When experts asked whether there were medical staff infections, local authorities said no. The expert said to the Caijing reporter, quote, "They didn't tell us the truth. From the real situation now, they were lying," unquote. Also on that day, the New York Times quoted the Wuhan City Health Commission's declaration that there's no evidence the virus can spread among humans. In the meantime, Chinese doctors continued to find transmission among family members, contradicting the official statements from the city's health commission. Also on that day, the massive Chinese New Year migration started. In China, every year, hundreds of millions travel from the cities where they work back to their hometowns to spend the Chinese New Year with their family, and it is called the largest annual human migration in the world. So during this largest annual human migration in the world, no disease prevention or control measures were adopted whatsoever at any place, including at Hankou railway station in Wuhan, which is less than 1 mile from the epicenter, as well as all major stations in other big cities. Crowds traveled in closed space on top of one another, spreading the virus to all directions. Okay, on January 11th, Chinese health authorities shared the genome sequence with the WHO, and in Wuhan, despair rose when the Wuhan Municipal Health Commission officially announced the death of a 61-year-old man from this new virus. He was the first victim of something that didn't even have a name, and the CCP continued to keep it silence. Also on January 11th, the 7-day two important CCP conferences commenced in Wuhan. These two conferences were called Lianghui in Chinese, referring to conferences of the People's Congress and the Chinese People's Political Consultative Conference. They are regarded as the most important annual political conferences in China. In those two conferences, the coronavirus was not mentioned at all. On the day when the most important conferences were held, Wuhan health officials reported a drop in the number of infections from 42 on January the 3rd to 41. The Wuhan City Health Commission issued an update declaring, quote, "No new cases have been detected since January the 3rd, 2020. At present, no medical staff infections have been found, and no clear evidence of human-to-human transmission has been found," unquote. During the 7 days of the conferences, no new cases were reported. As a matter of fact, after the two important political conferences ended on January the 17th, Wuhan's reported case number remained at 21. It has never increased since January the 3rd. In the meantime, nearby countries and regions including Hong Kong, Vietnam, Singapore, Thailand, Japan, South Korea, etc. have all found cases. Many Chinese netizens at that time joked about this virus only staying in Hubei without going to any other provinces in China and only infecting foreign countries, so it should be called patriotic virus. At that stage, a study by an expert in the UK says global cases should have surpassed 1,700. So it was very obvious that to maintain a good atmosphere for the two political conferences, the CCP deliberately suppressed the numbers. Also on that day, Professor Zhang Yongzhen's research team shared the viral genome sequence information on Verilog.org website and the Gene Bank, and became the first team in the world to publish the viral sequence. The release of the data helped researchers develop test kits for the virus and was of great importance. However, on January the 12th, which is the next day, Zhang Yongzhen's laboratory at the Shanghai Public Health Clinical Center was ordered to close for rectification. No reason was given as to why the lab was closed. A source at the Shanghai Public Health Clinical Center said to South China Morning Post that the closure has greatly affected the scientists and their research when they should be racing against the clock to find the means to help put the novel coronavirus outbreak under control. At this stage, we can say the same mistake and tragedy appeared once again, like what had happened in the end of December. Scientific results were suppressed time and again out of either the ignorance, the arrogance of power, or perhaps more sinister motivations of the CCP. And the result is what we are facing today, an unprecedented global calamity. I think no one can fathom the significance of this calamity yet. Okay, let's take a break here and continue to discuss what would happen next. Thank you for watching. True information does save lives, so please subscribe to my channel and share it. Thank you. See you next time.